About 10% of people with diabetes have juvenile diabetes, commonly known as type 1 diabetes. It is mostly discovered in children and adolescents, say 0 to 14 years, hence the name juvenile. Type 1 diabetes has nothing to do with lifestyle choices and dieting. It is an autoimmune condition involving destruction of pancreatic cells, leading to lack of production of insulin, hence impaired glucose regulation. Its risk factors include family history, that is being genetically passed. In type 1 diabetes, the patient's tissues attack the patient's own tissues, causing high levels of glucose in the blood. Hence, the symptoms may occur suddenly. Pleuria, which is increased urination either by volume or frequency, that is, you go to the latrine often. Frequent urination at night, or nocturia, that may explain sudden bedwetting in some children. Habitually, kidneys absorb glucose as it is a source of energy, but due to the high levels of glucose caused by lack of production of insulin, water flows in for it to be excreted. Hence, the frequent fail to urinate. Patients also feel thirsty for a significant amount of time, hence increased intake of water. One may also increase the intake of food, as the cells do not get energy from the glucose, as insulin is not produced to transport the glucose to the cells, a process that will be explained in this channel. So keep in touch by subscribing and ensuring that you hit the notification bell to get notified whenever we upload. However, the patient may lose significant amount of weight because glucose is not broken down properly. Due to the water loss through urination, the patients can experience dehydration. That can be detected through a number of ways: dry skin, sunken eyes, hypotension or low blood pressure, and lack of tears in severe cases. Blood vision, delayed or impaired wound healing, fatigue, increased risk of infection, mostly the fungal and yeast infection, particularly the oral and the vaginal infections, as yeast candida flourishes well when exposed to high levels of glucose. Those are some of the signs and symptoms of type 1 diabetes. In the next video, we shall learn on how to manage type 1 diabetes. Continue subscribing so that we stay happy, healthy, and strong. And see you in the next.